So how did I get into regenerative medicine and use it as a tool in surgery? And partly is because I've done it to me. I've had lots of surgeries on myself, and regenerative medicine is PRP, bone marrow, or cell therapy, we like to call it, shockwave therapy, all these things that help the body heal. I've had lots of surgery and not a fun process to go through. My body's been able to heal, but even after those surgeries, I still have pain and discomfort from multiple injuries. And so I've known about PRP. I've been using it since my residency, 2008, and PRP is a very good way to get you to heal. And so again, why am I using it more and more now? Because my goal is I want to keep you out of surgery. I want to get you better and let your body heal on its own without potentially having to have surgery. I don't care what the MRI looks like. I don't care what the X-ray looks like. It's how do you feel? Because if all we did is look at X-rays, we'd be doing lots of surgery and lots of procedures that didn't need to be done, especially if you have a bad-looking ankle joint or a bad-looking heel on X-ray, but it doesn't hurt you. Great. The goal is to get you better and keep you better and do things that we shouldn't be doing just because we see something on an image. Regenerative medicine is a great tool to help you get better. PRP is taking your body's blood, spinning it down, separating the platelets and plasma, and injecting into those painful areas. You can also do that same process by harvesting your bone marrow, small amounts of bone marrow, and then we concentrate that down, which has even more of the growth factors and healing potential than PRP does. Whether we do bone marrow, fat cells, PRP, or even, and then augmenting that with shockwave therapy, that's how we get you better. So the goal is, if you've had surgery and you're hurting, we want to get you better because again, it's not fun being in pain. Nobody likes it. With PRP or this regenerative medicine, the goal is to get you back on your feet faster and get you to trust your body, because that's one of the things I think hurts people the most is when you've been hurt for a while, you lose trust in that body part that's hurt. And so when you wake up every morning thinking about your foot because it hurts, I always tell patients, what's the other foot feel like? Do you ever think about your left foot if your right foot's hurting? And most of the time they're like, nope. And I always tell them, because you're not supposed to think about your feet. You're just supposed to get up and walk and go and trust your body. And so regenerative medicine in my hands has been a great way to get people to trust their bodies again and to get them to heal and get out of that pain cycle and get them back to doing those things they like to do. So again, I think part of getting you able to trust your body to not hurt is also address the root cause that led to that particular injury. Now, if it was, I'm playing basketball, I came down on somebody's ankle or foot, well, that's different. We can still address that issue. But if it's, it's the genetics you were born with, the way your foot works, all those little bones that are in the feet, they have to work like that to help you take a step. No different than your eye. When you're sitting and looking at something, you have all these eye muscles that are contracting and relaxing in milliseconds to help you get a clear view, and you don't think about it. And that's how it's supposed to be with your foot, your ankle, your leg, really anywhere in your body. And so if we can address the cause that led to that pain, and maybe even the potential surgery that resulted from that, and you're still having that pain, let's address the cause, get the pain better, and then we get you back to doing what you want to do. So if you found this video valuable, hit like and subscribe and drop a comment below. If you're in Arizona and dealing with foot, ankle, or leg pain that's not going away, you've had surgery, you're not trusting your body, come see me, Dr. Keith Bangart at Restorative Edge Clinic. We'll get you back on your feet faster and getting back to doing those things you love to do.